Thanks for tuning in today. I'm Dr. Nick, the Incrementalist. Join me as I seek out the small incremental changes being applied in other industries that we can learn from and that can be applied in healthcare. Can these changes bring immediate value, but also add up to the big improvements and revolution we need in healthcare? Come along with me to explore the possibilities. My innovative guests from around the globe have used small incremental improvements to achieve their moonshot. And today, I'm delighted to be joined by Dr. Ben Kanter. He is the CMIO for Vocera. He's also an old colleague and friend. Ben, thanks for joining me today.
Nick, I appreciate it. Thanks for having me.
For the benefit of the listeners that aren't lucky enough to know you as I do, it would be good to hear a little bit of your background, lots of relevant clinical background as well as technology background before we talk about some of the solutions and the things that you've got to offer.
Well, I appreciate that. So from the clinical side, let's see, I was a pulmonary critical care physician for 25 years, both outpatient and inpatient, although certainly the last half of my career focused on what was happening in hospitals. Practiced in San Diego. I did my postdoc work at UCSD Medical Center. And then as part of the medical staff, I did the usual medical staff leadership roles. Chairman of department, ended up as chief of staff on the executive team of our hospital system. And I was our hospital's CMIO, started part-time as CMIO in roughly 2003 until I was recruited out of the hospital system in 2014.
So not only this long extended clinical background, but then you merged into the whole technology side. And that was certainly around some of the time that you and I interacted. Obviously, an exciting time, lots going on. Tell us a little bit about your experiences there, because I know you did some pretty interesting and exciting things, in the time in your technology leadership.
Yeah, it was. I feel very lucky in retrospect when I look back and sort of see how my career has turned over the years. A lot of it has really been dependent on those folks that I've been around and the projects that just happen to be ongoing at the same time. So at Palomar Health in San Diego, where I was in practice, we opened a brand new medical center in 2012, which got named the #1 new healthcare project in the U.S. We were named the 3rd most technologically sophisticated hospital in the U.S. and the 5th in the world in one poll, which is amazing for a small suburban hospital. It was a 5-year project, and back in 2007, we had a large advisory team, which included lots of major companies that everybody would know the name of, but one in particular was Qualcomm. And Qualcomm asked me and 2 others to come in and talk with them back in late 2006 as they were getting into healthcare. And at that time, I brought to them the issue of critical event notification. How do we close the loop on all of these events that are taking place and make sure that responses are happening as efficiently as possible? And I've been working on critical event notification and workflows related to hospital-based communications since 2007, not just originally with Qualcomm, but with many others. And as you know, I think you were with Nuance when you and I first met. I was on their customer advisory board. I was on Cisco's and other corporate advisory boards as well. So I've done development on the mobile side. I've licensed technology that's in use in the market today. When I got recruited outside of Palomar, it was initially to Vocera Wireless. Vocera was really fascinating technology, focusing on something of great clinical interest to me, which is the early detection of the deteriorating patient. As a critical care specialist, the constant refrain was, gosh, if I had only known about this 10 hours early.
I don't think it's just critical care, folks, to be honest, but
right.
Yeah.
So if we could do continuous physiological monitoring outside the ICU, which is what Vocera does, we were able to really pick up signs of deterioration. And so that was a fascinating couple of years. That company was restructured, is now part of Foxconn. And I moved on and have been with Vocera for the past 3 years. And it's really been very exciting for me because I've gotten really to continue a lot of the work that's interested me for more than the past decade.
That's fantastic. So, I think the important thread in all of that is closing the loop and making sure that the communications run smoothly, which, in the days of paper and telephones and pages was already a challenge. And then we put all this technology in and assumed that it would all work and people would communicate, but that's not what happened. We've been struggling with it, which brings us to Vocera. So for the people that don't know, I know how I describe it, but I want to allow you to describe it in the first instance. So tell us who Vocera is and what they do.
So you probably remember Vocera as the quote unquote badge company, as the Star Trek badge company, right? So it was started almost 20 years ago, or at least 20 years ago. And the focus at that time was on this wearable badge that was purpose-built to improve communications and be as hands-free as technology at that time would allow it. And what that means is we've had a voice interface, actually leveraging nuance technology for that long. So when people talk about, hey, I can speak to my smartphone, I can use my Alexas and my Siris of the world, we have enabled the ability for folks to dispose of the need to know phone numbers in the hospital, for almost 20 years now. And what that means is I'm able to call Nick, call Dr. Nick, call Nick on the third floor, call critical care supervisor. I can call by role, by name, by location. I can call groups. If I'm in a panic or duress situation, we've got a built-in panic workflow. So it really simplifies communications. And originally it was a point-to-point sale. So in other words, for example, peri-op or in the NICU, they would want to improve communications. And this was primarily a nursing tool originally. Much has changed. Much has changed. And it is no longer just that endpoint device. We are really a full, complete, what's known as communication and collaboration platform. So what do? I think the easiest way to describe it is the following. First of all, we're an aggregator and integrator of hospital information. So we have a layer within the architecture of our communication platform that lets us interoperate and integrate with more than 150 different hospital systems. I mean, if you think about it today, the Internet of Things, that's happened in hospitals a long time ago. Almost any technology you put in the hospital has the ability to send an alarm. And that's part of what's leading to this, the problem with alarm fatigue and the chaos that's in hospitals today. So we can grab all of that information from different systems and we can put that information together. So information ordinarily might not ever sort of be combined. And using that, we can then determine, hey, is this information that's important? And if so, then who do we message it to? So we allow disparate systems like, let's say, a bed alarm that says, hey, this person's getting out of bed. We can integrate that with an ADT feed from the electronic health record to know who that is. We know who the nurse is that's assigned to that patient at that moment. We can pull out the patient's fall risk from the medical record as well as their weight. And using that, we can customize for them a personalized out-of-bed alarm. Is that somebody who's allowed to be out of bed and has no risk, in which case we can suppress the alarm? Is that somebody who's at high fall risk? Maybe we need to send a high-priority alarm to everybody on the unit and everything in between. So we take an ordinary out-of-bed alarm and we customize that sort of thing. That applies to everything from sepsis alarms to anything else you can think of. So we do the work with the alarms and alerts. We also provide the secure voice communications that I talked about, as well as all the secure text communications, because alarms are really nothing more than a clinical decision support message. They're just another form of text. So we handle all of the communication needs, and then we audit all of that and provide the reporting. Because everything can flow through us, we can start to orchestrate what otherwise could be a really chaotic environment. So we can say, hey, we have a patient who's asking for water, but that patient's nurse is at a code blue. Guess what? We're not going to interrupt her for water, right? That's simple. That's kind of, it makes sense, but you want to have that kind of logic in the system. for me, that's really the fun part of this, is really helping to design workflows that just improve the safety and efficiency for everybody, the nurses, the physicians, the patients, the hospital.
So I have to imagine, as I listen to that, and you sort of cite some what are clear examples that in the experience of this implementation in hospitals, you would see a reduction in this fatigue from unnecessary alarms. Is that what you've seen? Is that the sort of experience from the customers?
Yeah, the goal here, we actually focus on what we call interruption fatigue, because alarms are just one type of interruption. We know that nurses were getting interrupted for all sorts of reasons before they ever put smartphones in their hands. Now nurses are carrying smartphones. That's supposedly a very good thing. Heck, I'm the CMIO of a communications company, and I'm here to tell you that, yeah, I like the idea of nurses having mobile computing that also has telephony and text messaging and access to the EHR in their hand. That's wonderful. But you better do it with your eyes wide open, because there are mistakes that you can make. And they're mistakes that people make with the best of intentions. It's sort of like every system that's out there says, I want to send this message directly to the nurse responsible for that patient so it doesn't get delayed. Love it. Great idea. But if every system that's involved with that patient does that, then the nurse never has a chance to take care of a patient. The nurse takes care of his or her phone. So you have to really think through, because the bandwidth to attend to all of that is really problematic. And so again, when we set our systems up in hospitals, and we're in more than 20% of U.S. hospitals, we're international. We've got, we're working on close to 2,000 hospitals around the world. We've done this a lot. So we have best practice guidance. And again, one of the pleasures for me working at Vocera is I am one of many clinicians. Yes, we're a technology company. Yes, we make communication hardware, software, platforms, et cetera. But we have more than 50 nurses and two medical physicians, two physicians that are on staff, myself and Bridget Duffy. And having the experience to work with Bridget, who was the first chief patient experience officer in the U.S., she was the CXO at Cleveland Clinic, has been a real joy.
Fantastic. So for those of you just joining, I'm Dr. Nick, the Incrementalist, and today I'm talking to Dr. Ben Kanter. He's the Chief Medical Information Officer for Vocera. We were just talking about the whole process of alert fatigue and how all of this technology and insight. So I think the connection of all of the underlying information is one of the sort of critical elements to this, which is, you just don't throw out an alarm because, hey, as an isolated unit, I'm alarming, so therefore I must throw that out. You're sort of processing that in the context of all of this. And then the reduction, as you put it, the interruption fatigue. I love that. I want that for teams, quite frankly. We could have interruption fatigue. We could have Vocera on phones just to remove all of that activity that seems so unnecessary. But that's a whole separate conversation. What's really interesting and contextual to today, and who knew several weeks ago that this would be the case, but one of the really important points is that this is a point-to-point communicator, but it has the capacity to work in environments where you have limited access to your hands for a variety of reasons, obviously in the operating room and so forth, but also importantly, when you're wearing protective equipment. And in the current crisis that we've got with COVID-19, I think Vocera is set up as a solution that works in there. Tell us a little bit about that and how that works.
Yeah, so when we were designing the equipment, our endpoint devices, our badges, and we have our legacy badge, what's known as the B3000, and we have what we call our smart badge. Both are specifically designed to work underneath PPE. This is actually very personal to me. My daughter is the ops manager for the University of Pennsylvania's drive-through testing center for COVID. My wife is an infection preventionist. I worked as a critical care specialist for 25 years. We know that the PPE is in short supply. We also know that every time you have to remove your PPE, you risk self-contamination. There is no reason why you should have to risk contamination do communication. And that seems trite, but it's real. When you're garbed, when you've donned your PPE and you're caring for a patient who is in isolation, if you have an urgent need to contact somebody, you generally either have to go to an anteroom, doff your PPE, and find somebody. It simply isn't an easy thing to do. And a lot of times you simply yell out the door and hope that somebody hears you. So the goal here is to allow somebody to simply say, hey, Vocera, call radiology. Hey, Vocera, call unit clerk. Hey, Vocera, call lift team. And you have immediate access to what you need. That's what we do. And we do that today. And hospitals are using us for that purpose, not just in isolation rooms in the hospital. They're using us in ICUs. They're using us in triage tents. All they have to do is extend their Wi-Fi to the triage tent. And you now have the same efficient communications outside in a triage tent that you would have within the four walls of your hospital. So that's one major purpose.
So for the purposes of, delivering this, the key elements are you have a local device that the individual wears, and then it's based on Wi-Fi. So extending Wi-Fi into the car park or in these hospitals, relatively trivial tasks. So that enables that communication. And then you're essentially plugged into all of the systems. You get all of the facilities that come from being in a regular hospital setting. Is that true?
Yeah, so it all depends on which systems we've integrated with. And we're not limited to just our devices because we're really agnostic. Some of your folks, like the physicians, are generally going to be BYOD on a smartphone. That's fine. Everything we can do on our devices, we can do on a smartphone and more. So we don't care if they're using iOS, Android, our devices, or somebody else's. Really doesn't make any difference. But I'll give you, here's an example, and it gets back to something you and I were discussing at the beginning, and that is hospitals generate a tremendous amount of data. The real issue here, not only from a clinical standpoint, but also an operational standpoint, is how do you become aware of important data, important information? How do you transform that data into information and then act on it? So hospitals today, this is a really, pertinent example, I think, with COVID. You send your COVID out for testing and you want the result back. The faster the COVID result comes back, the faster you can make an assessment. Does that patient who you currently have in an isolation room need to stay in isolation?
Right.
We know that the majority of COVID tests come back negative for COVID, positive for something else. Do they still need to be in isolation? So hospital throughput is key right now. We know that getting patients in and out of the hospital is going to be absolutely crucial. So with our system, we can link directly into either the EHR or the lab information system. As soon as the COVID test result is back, that can get pushed immediately to the nurse caring specifically for that patient and or the physician caring specifically for that patient. So they don't have to keep going back to the electronic health record and going, is it back yet? Is it back yet? Is it back yet? Looking at the portal, calling into the lab. We push it directly to them. That shortens the time to act. That's really the value add for the hospital here, whether it's shortening the time to act on COVID, shortening the response to a rapid response call, to early sepsis, or to any other clinical or operational issue.
So you talked a little bit about this, that it's available and it works, but I think one of the things that seems to be the case is that sites have this capability, but they're not using it in the context that you described. Is this changing? Are you getting that message out? Because clearly it's highly valuable. I mean, I understand the personal nature of this. The risks associated with being at that front line of testing is enormous because of the way in which we test and the exposure to the viral loads in those individuals. And obviously you want to maintain that protection for as long as possible. Are you getting this message out? How are you getting this message out?
Yeah, no, that's actually front and center for everything we're doing right now. We are so busy on the marketing side, and it's really not that we're marketing our solution, it's that we're trying to get the word out. You and I we're both physicians. We both, have been in IT a long time. We know that one of the problems hospitals have is they purchase technology They use it for what they originally purposed it, and they don't always think, how can I repurpose what I already have for new issues? And so one of the things, so I've posted, for example, on the AMDIS listserv, for physicians that are at hospitals that are using Vocera, remember this is purpose-built to be used underneath PPE. We are pushing this information out to nursing leadership around the United States. I did a blog post on this last week. It got something like close to 300 individual reads, something like in 90 minutes. Again, getting that message out saying, if you have our equipment, please be aware that it is this kind of turnkey process. We've also spun up an internal team that is doing nothing but what are the specific workflows that we're hearing from our customers, right, that are valuable in this age of pandemic, that we can then push out and let everybody know, here's the turnkey solution to operating your triage tent. Here's the best way to use our equipment under PPE in this kind of situation. So we are doing that. And then obviously from a corporate standpoint, we are making licenses available for free to those that already have our product to expand the use, because there's just a tremendous need right now. We're really getting a lot of calls about expanding the use of our equipment in hospitals that already have it. So we're doing everything we can to reach out and help.
We've just got a couple of minutes left, just for clarity, to make sure I understand. This works. It's actually underneath the PPE, so it doesn't have to be outside, so you don't have any of the issue of contamination through that. Is that true? So it's working through these protective gear?
Yeah, there's you can either use its microphones that are underneath the PPE, or you can use either a Bluetooth headset or be wearing earbuds, and that will allow full two-way communication with the device.
Fantastic. So ideally suited in many instances, and I think what we're all learning through this crisis is many applications, many things that we didn't even think about through this whole process of the way that we interact with each other, this sort of social distancing, that it's a term I really dislike, I have to say, because I think it goes against the sort of grain of humanity almost, but it's important, and how we support that in the context of a healthcare setting where we've done things completely differently in the past, but we're having to change. So I think it's not limited to the short term, but in the longer term, this is going to become increasingly relevant.
Well, we've known that physicians are doing procedures and their hands are busy. Nurses are with patients. Physical therapists are helping patients ambulate, and patients are starting to fall. And so the idea of hands-free communication is a natural. And to be honest with you, in the age where we can talk to almost any device in our house, it's really an expectation that I should not have to put hands on my communication device. Yeah,
absolutely. I think, time for the technology, the integration of voice into our world, which is a sort of natural, I think huge opportunities. Delighted that, both you're working in this space, but also helping get the message out to your customers and other people. This is a challenging time. Unfortunately, as usual, we've run out of time, so it just remains for me to thank you for taking the time out to speak with me today, Ben. Really appreciate it.
Nick, it's great seeing you. It's great speaking with you again, and I appreciate being on. Any questions in the future, I'm happy to do this again. Thank you.
Thanks for joining me today. Do you have any better ideas, or have you found a small incremental change that's brought about a big improvement in your world? Let's continue the conversation on our hashtag, The Incrementalist, or share with me at DrNick1 on Twitter. You can find more information about the show on our program page at healthcarenowradio.com, and tune in next time to hear my discussions with leaders and innovators from around the globe who've revolutionized their space by using small incremental improvements to achieve their moonshot. I'm Dr. Nick, the Incrementalist, and I'm starting a revolution through evolution.